Hi, my name is Katie, and today we're going to be discussing chronic kidney disease. Chronic kidney disease is a growing problem in the United States. It affects 1 in 7 adults, which is about 35.5 million people. In 2021, the mortality rate was more than twice as high among Medicare beneficiaries ages 66 years or older with chronic kidney disease than among those without. And in 2021, $77 billion of Medicare spending went to beneficiaries who have chronic kidney disease. This disease is negatively impacting not only the individual, but the entire healthcare system. Even more alarming is that as many as 9 in 10 adults who have CKD are not aware that they even have the disease. This is why it is so important to educate our population on CKD and help prevent the poor health outcomes that this disease is causing. From a personal perspective, I chose this topic as my father experienced a significant infection in 2024 that nearly shut down his kidneys. Though I have a strong background in the healthcare field, I did not recognize the symptoms my father was experiencing as impaired kidney function. Thankfully, with excellent emergency medical care and a lengthy recovery, my dad survived and his kidneys did recover. But my father's health outcome is not a common one, and it brings to light the need for increased education on chronic kidney disease. To understand how chronic kidney disease impacts an individual's health, we must understand first how healthy kidneys function. One of the most crucial functions is removing waste and excess fluid from your body. Your kidneys help to maintain a healthy balance of water, salts, and minerals in your blood. And this enables your nerves, muscles, and other organs to function properly. Kidneys are composed of 1 million tiny filtration units called nephrons. Blood is passed through the renal artery of the kidney and then continues into a network of smaller blood vessels until it reaches the nephron. Each nephron has a glomerulus and a tubule. The glomerulus is a cluster of capillaries that allows waste and fluids to pass into the tubule, while proteins in blood cells stay within the capillaries. The tubule has a blood vessel running next to it that reabsorbs the water and essential nutrients your body needs. This tubule removes waste from the blood, and this helps maintain the body's proper acidity level. The filtered blood then passes through the renal artery and back into your bloodstream. The waste within the tubule becomes urine, which is transported to the bladder and excreted. A second important function of the kidneys is regulating your blood pressure. Your kidney cells make an enzyme called renin, which maintains healthy levels of sodium and potassium in your body. When an individual's blood pressure becomes low, this stimulates the kidneys to release renin into your bloodstream. Renin also partners with angiotensinogen produced by the liver and aldosterone, a hormone, to increase the amount of water in your body and raise your blood pressure. Kidneys also produce erythropoietin, a glycoprotein that is stimulated when the blood has low oxygen levels. It sends a message to your bone marrow cells to produce oxygen-rich red blood cells. Reduced kidney function can be caused by many different mechanisms. The most common causes of CKD are diabetes and hypertension. It can also be caused by infections, dehydration, or chronic use of medications like non-steroidal anti-inflammatory drugs and antibiotics. Genetics can also influence your risk of kidney disease. Polycystic kidney disease is a genetic disorder that causes many fluid-filled cysts to grow in the kidneys, which can impair their function. There is also rare genetic conditions such as Alport syndrome and neuromodulin-associated kidney disease. When the delicate capillary system in your kidneys is damaged by a disease or infection, in response to the injury, fibrous connective tissue forms within the blood vessels. This fibrous tissue obstructs blood flow and filtration is stopped. If an individual continues to form sclerosis, there will be fewer functioning glomeruli in the kidneys. The body responds to this by pulling the blood to the healthy glomeruli instead of the damaged glomeruli, and this leads to hypertension in the functioning glomeruli. The increased blood pressure within the healthy glomeruli causes a vicious cycle of spreading sclerosis. In early stage CKD, an individual's glomerular filtration rate is reduced, and there is a substantial increase in water and salt in the blood, which can cause high blood pressure and swelling in the legs. As the disease progresses to stage 4, the kidneys are no longer able to filter out excess phosphorus from the blood, and an imbalance in calcium levels occurs. Unbalanced calcium levels can cause bone disease and vascular calcification. Anemia is also common at this stage in CKD due to the kidneys failing to produce erythropoietin, which stimulates the release of red blood cells. In near end stage CKD, metabolic acidosis can occur because the kidneys are unable to filter the acids within your blood. In addition, hyperkalemia occurs, which is a life-threatening condition and can cause cardiac arrest. End-stage renal disease requires hemodialysis 3 times a week, and a kidney transplant will be necessary to increase life expectancy. Chronic kidney disease is often not diagnosed until the disease has reached the later stages. This is because the symptoms of CKD manifest slowly over time. Blood work can identify preliminary stages of kidney disease when symptoms are not apparent. Physicians will look for elevated levels of waste in the blood and can check your estimated glomerular filtration rate, or eGFR, which will indicate how well your kidneys are working. Stage 1 is characterized by an eGFR of 90 milliliters a minute or above. Stage 2 is characterized by a eGFR of 60 to 89. Stage 3A is characterized by a eGFR of 45 to 59. Stage 3B is characterized by an eGFR of 30 to 44. Stage 4 is characterized by an eGFR of 15 to 29. And end-stage kidney failure is characterized by an eGFR of less than 15. Your physician can also detect chronic kidney disease by performing urine analysis to look for traces of protein and blood. As chronic kidney disease worsens, symptoms such as nausea, vomiting, loss of appetite, fatigue, sleep problems, decreased cognitive level, high blood pressure, and fluid in the lungs can manifest. The first step in treating chronic kidney disease is attempting to identify the underlying cause of the disease. In certain cases, early stage chronic kidney disease can be caused by severe dehydration, medications, and urinary tract infections, which are all reversible conditions. Chronic kidney disease can also develop from untreated hypertension, diabetes, and heart disease. Identifying these underlying causes is crucial in treating the disease successfully. Effectively controlling high blood pressure can slow down the progression of the disease. And this can be done with medications such as ACE inhibitors, angiotensin II blockers, and diuretics. Dietary changes such as reducing sodium and protein intake and increasing heart-healthy foods is recommended. Increasing exercise levels is also shown to be beneficial. As chronic kidney disease progresses, your kidneys have difficulty making erythropoietin, the hormone that directs the production of red blood cells. Erythropoietin-stimulating agents can help restore the red blood cell count and help with anemia. As chronic kidney disease progresses into the more advanced stages, hemodialysis may become necessary. In hemodialysis, a dialysis machine pumps blood through one end of the filter and is forced into many very thin hollow fibers. As your blood passes through the hollow fibers, dialysis solution passes in the opposite direction on the outside of the fibers. This process allows waste from your blood to be collected in the dialysis solution, and your filtered blood will be returned to your body. Months before dialysis treatment begins, a vascular access site needs to be established. There are 3 types of vascular access: a AV fistula, an AV graft, or a catheter. Dialysis needs to be completed 3 times a week, and each session takes approximately 4 hours. In end-stage renal failure, it may be recommended to receive a kidney transplant. Kidney transplants can come from living donors or deceased donors. Patients must understand the risks associated with having a transplant, and if a patient has underlying heart disease, they may not be a suitable candidate for a transplant. There are new and promising kidney disease treatment options being researched currently. UC Davis is conducting a trial on the use of cell therapy to repair damaged kidney tissue. This therapy uses the patient's own kidney cells to create a hydrogel that is reintroduced to stimulate the natural repair process. Another exciting innovation is bioartificial organs. UC San Francisco's Kidney Project is developing an implantable bioreactor that mimics kidney functions using silicone nanopore membranes and human cells. And to decrease organ discard rates, companies such as Northernmost and 34 Lives are creating portable systems that maintain organ viability during transport. Despite chronic kidney disease being associated with severe health risks, population-based screening guidelines are non-existent except in diabetes patients. Remember that type 2 diabetes and hypertension account for 85% of global growth in the chronic kidney disease burden. Screening for CKD is recommended at least once a year in all patients with type 2 diabetes, and after 5 years of a patient having type 1 diabetes. Screening tests include checking the patient's eGFR and urine albumin to creatine ratio. Once a patient has been diagnosed with CKD, it is recommended that a regular reassessment be done every 3 to 6 months. This includes checking the eGFR, urine, blood pressure, glycemia, and lipids. Frequent risk monitoring is essential to reduce poor health outcomes in CKD patients. Patients with chronic kidney disease that receive regular reassessments by their physician reduce their risks of heart failure, cardiovascular disease, and even death. Physicians need to be aware of patients who have a higher risk of developing CKD, such as those with a family history of kidney disease, hypertension, or cardiovascular disease, and screen them appropriately. Detecting chronic kidney disease in the early stages is crucial to the health outcome of the patient. Early stage CKD can be managed with diet modifications, lifestyle changes, and medications. Once CKD becomes advanced, a patient's quality of life is greatly impacted. Dialysis will be needed, and the symptoms of advanced chronic kidney disease, such as fatigue, nausea, and cognitive impairment, can interfere with an individual's ability to work and do daily activities. The Centers for Disease Control and Prevention have created a chronic kidney disease initiative to raise awareness. This program includes the Kidney Disease Surveillance System, which tracks chronic kidney disease and its risk factors in the U.S. population over time. The CDC also publishes the report Chronic Kidney Disease in the United States, which contains data on the prevalence, health consequences, risk factors, prevention, and treatment strategies of chronic kidney disease. Why are health education programs so important? Well, health education programs increase awareness and motivate individuals to make health behavior changes. This can help reduce the rate of chronic diseases among a population. Programs can educate community members on the risk factors of chronic diseases. Increasing the health literacy of a community can empower them to be able to make evidence-based decisions on their health. Health education programs also promote healthy lifestyle changes, which can decrease the community's risk of developing diseases like CKD. Community health programs improve individuals' access to valuable health information that they may not be able to get anywhere else. Earlier in this presentation, we discussed that 9 in 10 adults are not even aware that they have chronic kidney disease. This statistic is the reason that health education is so vital to the health outcomes of patients. A patient that is informed of the risk of developing CKD and is counseled on the importance of regular screening will be less likely to develop advanced chronic kidney disease. There needs to be more consistent screening for CKD at the primary care level, especially for those patients who are at higher risk of developing chronic kidney disease. Teaching patients about the signs and symptoms of impaired kidney function is also crucial to decreasing CVD complications and mortality rates. In addition, there needs to be more education on how diet and exercise can decrease your risks of developing chronic kidney disease. The effects of chronic kidney disease not only negatively impact the patient's life, but also the community and healthcare system. Individuals living with chronic kidney disease need more assistance from their families, especially those who are receiving dialysis. Chronic kidney disease can also cause other comorbidities such as diabetes and high blood pressure, adding to the care responsibilities for a patient's family. CKD has also created a significant financial burden on our healthcare system. As chronic kidney disease progresses to the later stages, the cost of caring for these patients increases substantially. In one study analyzing the global financial impact of chronic kidney disease on healthcare, it was found that the cost of treating stage 3 kidney disease increased on average by 4 times when progressing to stage 5. The cost per patient annually for hemodialysis is approximately $103,000, and the annual cost of treating a kidney transplant patient is approximately $120,000. There are about 35.5 million people in the United States living with chronic kidney disease, emphasizing the urgency for increased awareness. Education on preventative ways to decrease CKD prevalence is a necessity. Early detection of chronic kidney disease decreases advanced disease care costs, for our healthcare system. More importantly, it is our responsibility as public health educators to empower communities with health knowledge so we can ensure that they have more positive health outcomes.